No.
Good afternoon, ladies and gentlemen, and welcome to the Spectral MD Holdings half-year results investor presentation. Throughout this presentation, investors will be in listen-only mode. Questions are encouraged. It could be submitted at any time during the meeting. They can be submitted by clicking on the Q&A tab on the top right-hand corner of the screen, typing your question and pressing send. The company may not be in a position to answer every question it receives during the meeting itself. However, the company review all questions submitted today and publish responses where it's appropriate to do so. These will be available via Investor Meet Company dashboard, and you'll be notified once they're ready for your review. I'd like to now submit a poll, and before we begin, I would like to hand you over to Wenqing Fan, CEO, and Wang Long-Eng, CFO of Spectral MD Holdings. Good afternoon. Oh, it looks like we've just disconnected your audio there, Wenqing.
No.
Oh, you're
I got
back
it.
now. Fantastic. Thank you. Good afternoon, Wenqing. The floor is yours. Thank you so much.
Thank you so much, and appreciate the help. And thank you, and good afternoon, everybody on the line. And my name is Wenqing Fan, the CEO, co-founder of Spectral MD, and I'm here to present our first half-year results, along with our colleagues, Mr. Wang Long-En, our CFO, as well as Mr. Mark Dudek, my head of business development. And so without further ado, if you guys can see the slides, and let's go. So these are the customary disclaimers we need to put out and for this type of meeting, I guess. And here comes the quick summary. The key investment highlights at IPO for Spectral MD is that Spectral MD is a Dallas, Texas-based company. We have been building on over 100+ million U.S. federal government contracts for a burn indication. And we have been successfully raising fund from the AIM market, $16 million to be exact, on June 22nd, to support our expansion of our AI technology platform into the diabetic foot ulcer and other indications. Why are we doing this? Because these are substantial, high-growth wound healing diagnostic market opportunities. How do we do it? We do it with our FDA breakthrough designated AI technologies for wound healing diagnostics. And we're going to use our robust, ready-to-execute commercialization strategy to do it. For folks who don't know Spectral MD, we're a BARDA-sponsored federal government, U.S. federal government-sponsored company, and we're an AIM company listed on June 22nd of this year, and we already have FDA breakthrough designation, our burn indication, since 2018, and we're expanding our technology into diabetic foot ulcer and other indications. And that's what we have presented at the IPO 2.5 months ago to the folks. And here comes the investment highlights of the first half year. And Spectral MD, in one word, we have achieved all milestones set by this time in 2021. And we have also achieved other important milestones ahead of schedule, including but not limited to the early receipt of the increased U.S. government funding of roughly about $20 million post-IPO. And we have made progress on the new burn and DFU patients studies. The completion of our expanded proof of concept study, we call it fondly EPOC study for DeepView back into the Q1 of this year, showed our federal sponsor that we can actually carry out 124 burn subjects clinical study even in the face of a COVID. And with that kind of accomplishments, BARDA granted us a $20.6 million on March 22nd of this year. And then we IPO'd with an oversubscribed round of 11.3 million pound, $60 million on June 22nd. 2 days after IPO, we received a DoD contract of $1.1 million to help us further miniaturize DeepView. And then we entered this 18.8 million option 1B BARDA contracts 6 months ahead of schedule, and we announced it on September 6, 2021. For the DFU study, which the AIM round of funding supports, we enrolled 138 out of 150 subjects goal into the AI training study for the day one DFU healing assessment already. Those are the key highlights for the first half and post period I would love to bring to our public. And I would like to show us the first half 2021 financial highlights. For that part, I would request coverage from our CFO, Mr. Wan Long. And Wan Long, please.
Thanks, Wenchen. So we executed our IPO in June this year. Together with the barter contract, we have $18.5 million cash on hand, which puts us in a really strong position to fund ongoing burn and DFU development. So first half revenue was $7 million and expenses was $8 million. When add back the non-cash items, you get an adjusted EBITDA of negative $300,000 approximately. So as I mentioned, as Wenchen mentioned, we signed the new barter next phase of barter contract in September this year. As part of the IPO, we launched our new barter contract in March. Together with the two barter contracts, we are 6 months ahead of schedule to sign up all the different sites and patients. And with the IPO, proceeds from the IPO, we have, as I mentioned earlier, sufficient resources to complete not only the burns development, but also the DFU development. Wenchen, back to you.
Thank you, Wan Long. And for us, the thing here is this milestones and other comparisons. I want to show the public how much we have done and what we have accomplished. And for the milestones, this is a milestone we presented at IPO. And here is a top line is for BARDA contracts, which we have a through and through BARDA pathway to support with all this. The bottom is a DFU development pathway, which we raised the IPO round to support. And then if we could look into the 2021, and you can see that at IPO, we have a BARDA burn contracts of 21 million, and then we will execute both the adults and the pediatrics multi-center clinical trial for the training study. So what have we done for the first half 2021 and to date? So we have received 21 million award on March 22nd from our option 1A money. And then we have the BARDA sponsored training study kickoff event successfully held at SMD Dallas with 5 clinical sites coming from all around America. And we have that announced in early August. And we have these 5 clinical sites identified, training study initiated. We already have patients enrolled into the training study. And then ahead of schedule by 6 months, we just announced on last Monday, September 6th, that 18.8 million option 1B contract is also received awarded by BARDA. They give us this money so that we can streamline the whole training study in a more cost-efficient, time manageable fashion. For the diabetic foot ulcer, we have successfully raised the money from the AIM market, thanks to all the investors. And we also have the training study running at 6 clinical sites across US right now. 90% of our DFU subjects already enrolled out of a target 150 subjects. We have our initial DFU AI algorithm training starts already with the subjects finishing the study. Beyond all that, we also have received a DoD 1.1 million contract award to support miniaturizing of the DFU. This was announced 2 days post-IPO. This platform, the miniaturized DFU, will eventually be used for both DFU, diabetic foot ulcer, as well as the burn applications. Keep in mind, our DFU platform is one platform for all these different indications. And I want to show one thing to my belief is that we are getting all these things, what we should do continuously. We should improve, enhance, and make our SPECTRAL MD even more competitive. So I wanted to show all this key competitive edges we have at SpectralMD and at IPO, and compared to what we have achieved. So for the imaging modality, imaging system of our product, DeepView, in this first half year, we passed the 6061 testing, which matters to how the system can be used. Design validation completed. Investigational device already manufactured, and they're being used in our large-scale training studies. And then we have the AI model building. Back then, we have over 53.4 billion of clinical validated data points. Now, as of today, we have grown that database to 66.7 billion data points. And for the data extraction, we have the proprietary 3D wound tissue spectral data and the world's largest burn tissue biopsy database. And by now, we have the burn biopsy algorithm to be published. We have our EPOC clinical data analysis completed, and we have our DFU clinical enrollment over 90% completed. And what we do with our healing prediction, for the folks who didn't know SpectralMD before, what we're providing, like on that picture, on the left is a burn wound on a 3-year-old boy's chest. Is a heterogeneous burn. And what our results on the right with a highlighted color indicate the non-healing burn regions. And that's it. That's all we present with the original wound and the AI output of the non-healing region. And this will expedite the treatment pathway by 21 to 30 days. This tremendously reduces the opportunity for infections and complications, reduce the pain and suffering, and provide a much better cost saving for both the patients, the payers, the hospitals, and practicing surgeons. And for what we have achieved is we have EPOC as three sites completed. That's during the first half of the year. Then we have 3 clinical research publications already accepted to the Southern Regional Burn Conference in America for the podium presentations that covers burn algorithms, that covers adult study results, and covers pediatrics study results. And we have 5 sites for BARDA training study kickoff successfully held at the end of July. And from the IP perspective, at IPO, we have 5 issued US, 8 pending US. Now we have 6 issued and 7 pending. For international, we have 2 issued and 12 pending. Now we're actually having 4 issued, and actually we have 21 pending now because we have been focusing on piping out great technology perspectives. In summary, for this quick updates, we have achieved all milestones set by this time in 2021. We also have achieved other milestones ahead of the schedule, received the funding, roughly 20 million US government funding, and we're well on our progress for our DFU study that we raised the AIM round for. And with that, I'm going to go to the questions answers, and we'll go from there. Thank you very much.
Thank you very much indeed there, Wang Sheng. I think we are having just a slight issue with Wang Lung's connection, but if I may just turn back to you, if you can just see those that are coming through. If not, we're just going to dial him in. So if you can bear with me 1 second.
I'm trying to stay the power connected right now, and I might also need to log in from another computer. And if I have any interruption, just bear in mind that that's what's happening.
Sure, no problem,
I might have to switch to another computer.
No
and just to answer the first question coming through online, and there is a first question asked, who owns the data and what can you do with it commercially? SpectralMD has a full rights of the data and all the clinical information about it. And we are using it to develop our AI models. And for our burn biopsy database, we're also looking into setting up biopsy data foundation to further serve the broad medical world for further uses.
That's fantastic. I was just going to say, Wing Sheng, if attendees do want to please submit their questions, just click on that Q&A tab, type in your question and submit send. But just while the team take a little moment to review those questions submitted there, Wing Sheng, thank you very much indeed for answering that question. You will have the opportunity to provide your feedback post the presentation so the team can better understand your views and expectations.
So I got another question coming in, and it says, can you tell us about the business model and what risk of being U.S. government focused? Brilliant, brilliant question. Number one, business model. For the U.S. government, we will work with the U.S. government to help us populate our products to the 5,400 point of service, federally funded medical service points like the ERs, like trauma centers. So God forbid if there's another 9/11 or other similar kind of a situation, mass casualty situation, that we will have a system ready for use to quickly triage the burn patients for the right level of care and during those situations. And the business model for that is, along with the diabetic foot ulcer, is we will have a hardware piece for the pricing, but more than that, a more important part is a SaaS model, software as a service model, that we will have a profit sharing of per click fee. Of course, we'll pricing tier it, and to the point that we will make it both profitable to the physicians as well as to Spectrum MD. And the risk of being U.S. government focused is, I actually think the help from the U.S. government is a blessing, and they have been supporting us all this past 80 years, and they have done a great deal to develop this technology. Without them, I do not see the burn to be well developed as much as we have today. But you are absolutely right. We should branch out beyond just a U.S. government focus. That's why we have the DFU application, which is we call it Fundly as a commercial application because we rely on the commercial funding sources for it to be developed and eventually benefited in that way. So we have multiple avenues to go with our product DeepView, which can serve both a burn, U.S. government supported, and DFU, which is commercial side of supported.
That's fantastic. Thank you very much indeed for responding to those questions. Of course, any further questions do come through, the team will have the ability to respond to those post the presentation. Wang Sheng, if I may, if there are any final words you'd like to wrap up with, that will be fantastic.
All right, thank you. And we are Spectrum MD as the company. We're building, growing with a brilliant support from both the A market.
Hi there. I think we have just lost Wing Sheng with his computer, which I know the battery was going. So on that basis, I think we will conclude the presentation here. Could I please ask investors not to close the session, as you will now be automatically redirected for the opportunity to provide your feedback in order that the management team can better understand.
Can you hear me?
Yeah, you've just come back on Sam's computer there. Hi there, Wang Sheng. Sorry, I thought your battery may have just gone, so I was just asking the attendees just to
As a host to know that they need
to wrap up. So bear with me 1 second and we can just hear from you directly.
Here you go. Okay.
Wang Sheng, can you hear us now on Sam's machine?
Yeah, I can.
Perfect. I was just as I say, just asking for a few words, and you unfortunately cut out. So over to you, and then we'll redirect the attendees to give you some feedback.
Okay, all right. I just I'm going to giving you that statement. I think we are building a very, very solid company with our great team, with help from both the A market as well as the U.S. government, and we have achieved all of our milestones set for the time, and we have all this great funding from both U.S. government and other sources. So with that, we're growing commercially, both in the DFU and also in the region in UK and in the US. And I would hope for everyone, listening to this, help us to fill our 17 job openings and give us good leads. So down the road, we can do this better. And acquiring talent is definitely a great task to do. I would love to have everybody's help to grow our company together. Thank you very much for your time.
Sheng, thank you very much for updating investors there, and Wang Long, thank you indeed as well. Could I please ask investors not to close the session, as you'll be automatically redirected for the opportunity to provide your feedback in order that the management team can better understand your views and expectations. This will only take a few moments to complete and will be greatly valued by the company. On behalf of the management team of Spectral MD Holdings Limited, I'd like to thank you very much for attending today's presentation. That now concludes today's session. Thank you very much and good afternoon.